Auricular Therapy, a Practical Guide. Module 1, Introduction. I'd like to tell you just a little about myself. My name's Michael Vahila, and I'm a licensed acupuncturist as well as a licensed massage therapist. I teach the massage therapy program at Stark State College, and I've been using auricular therapy for about 10 years as one of the main modalities in my practice. But auricular therapy is just one modality, and there are many excellent modalities. They're all valuable, but they're all just one point of view. For example, in the icon in the corner, do you see two red faces against a white background, or do you see a white vase on a red background? They're both correct, but they're just one point of view. And if we can hold modalities in that thought, that they all address a piece of the healing puzzle that our patients present to us. So what I've done is boiled down for you a very complex subject and streamlined it into an easy-to-use protocol. I think you'll find it to be a valuable adjunct to the other modalities that you're already employing in your practice. The goals of this seminar series are to lay the foundation for understanding and applying auricular therapy, and to be able to use auricular therapy as an effective treatment for a wide variety of pathological conditions. Some of the advantages for therapists of auricular therapy are improved therapeutic results. Nothing's more satisfying than helping a patient who's had a difficult condition get better and having auricular therapy as part of that. Also, it's very user-friendly. If you're in a profession like massage therapy or chiropractic where you use your body physically all day, you'll find that sitting down for a couple of minutes to examine and treat the ear is a nice rest from your more physical activities. It's also relatively easy to learn and apply. A few basic principles and you'll be on your way. And you'll find that you get increased referrals from satisfied patients. So the advantages for the patients are similar. They have improved therapeutic results, which of course they like. You can also have extended treatment with pellets or intradermal needles placed in the ear that allow them to get relief and continue the therapy after they've left your office. And it can be very effective without touching the area of concern. So if someone comes in with hip pain, but they're in so much pain there's no way you can touch that hip, well, you can apply auricular therapy first to calm the area before doing any local treatment. So, just a little background on reflex systems. The ear is just one of many reflex systems, or sometimes they're called microsystems. And these microsystems interact with the macrosystems of the body. So the liver reflex in the ear interacts with the actual physical liver in the body. So other systems include the hand as a reflex system. Probably the most popular and well-known is foot reflexology as a reflex system. All acupuncturists learn scalp acupuncture in school, and all acupuncturists learn the diagnostic reflex system of tongue diagnosis, where the organs can be evaluated by looking at the qualities and textures and colors of the tongue. Even iridology is a reflex system, but a diagnostic one, where a practitioner can determine imbalances by looking at the iris of the eye. But this is not new. The oldest evidence of reflexology was over 2500 BC. You can see in this Egyptian hieroglyph, this person is getting foot reflexology, and this one is getting hand reflexology. And then on a more modern note, in the 1950s, Doctors Penfield and Rasmussen mapped out the brain as a reflex system and showed the various areas that corresponded to the body on the brain. Many times when people see a reflex system, they're understandably skeptical, but this has been validated by MRI studies done by Dr. David Alimi of France. In the first study, a clamp was placed on the thumb, and this area of the brain lit up in response to that stimulus. Then 3 gold acupuncture needles were placed in the ear, and noticed that the same area of the brain lit up in the MRI in response to that stimulation, showing the correspondence between the ear point and the body point. So as a basic definition, auricular therapy is the evaluation and stimulation of the external ear for treatment of health conditions in other areas of the body. Now, whatever kind of practitioner you are, make sure you stay within your scope of practice and determine which treatment modalities fall within your scope of practice. If you're a massage therapist, you can use pressure or acupressure pellets. An acupuncturist, of course, could use needles. Chiropractors might use electrostim or laser to stimulate the various acupuncture points or reflex points on the ear. And also, as a disclaimer, realize that auricular therapy is not a substitute for appropriate professional medical care, especially in a crisis situation. Get people to an emergency room. So that's the end of this brief introduction, and we'll see you at Module 2 for the anatomy of the ear. Thank you.